Hi everyone, Dr. Nemechek here. I want to touch on long COVID in kids. Now long COVID is, if you get COVID, you get these respiratory symptoms. Long COVID are these other symptoms that can persist, and we're finding like in adults they're persisting now for, in some cases it's been 4 or 5 years long. So it's turning into a big deal. So this is a large Italian study at a pediatric unit where they treat kids for all sorts of stuff. The majority of these kids were not hospitalized, and they ended up diagnosing, they have 1,129 kids that were diagnosed with SARS-CoV-2, that's COVID, and then were followed. And they were followed about every 3 months doing these different surveys. Now, of all these kids, about 68% of them had some symptoms that persisted after the infectious part of COVID was gone, okay? Now, long COVID is defined as you have them for 3 months. And so that ended up being 16% of all the kids had symptoms for 3 months or more. These could be respiratory symptoms, neurological, cognitive symptoms, intestinal symptoms like diarrhea, fatigue, sleep disturbances. All right? And here's the thing that really concerns me. Okay, it sounds like, okay, these kids have some other stuff. It lasts a long time. All right, so here, A, are respiratory symptoms, and you see these are months. 18 months. So if your kid has some persistent symptoms, more than 75% still had those symptoms a year and a half later. Okay, here's neurological stuff. This is like POTS, lightheadedness, can't focus. Here, this has got to be 85% of the kids. The symptoms are persisting for a year and a half, 18 months. See, fatigue, this is even higher. Okay, this is 85-90% are still having those symptoms for a year and a half later after COVID, and then gastrointestinal symptoms. Okay, see, this doesn't go away. All right, now if you look at my other videos, there's a whole other line of work showing that long COVID patients have high levels of inflammation, and they're leaking it to a particular kind of leaky gut. This is the intestinal tract barrier. Okay, here's normal, nothing leaks through. This is SIBO, I've got videos on that. It leaks through the middle. And then here's COVID. See how that looks different? Cells die and leave this gap. Now, I'm here to tell you, you can treat this successfully with a 6-week course of glutamine. It's an amino acid, it's inexpensive, it's safe. You can buy it on Amazon or wherever, and you can take care of that if your kid's having symptoms. And then a large number of, this is adult data, after 6 months of COVID and having long symptoms, a large number of the adults now are starting to trigger SIBO on top of it. So you kind of have to treat both. Anyhow, so a little something about COVID. Yeah, and just a brief thing, vaccines lessen the likelihood of long COVID, and if the kid's old enough, treatment with anti-COVID antibiotics also decreases the chance of this happening. So that's all for today. Everybody, take care of your kids, take care of yourself, keep your inflammation down. Till next time, it's Dr. Nemechek. Take care.